Good day, everyone. My name is Sonia, and today I'll be presenting about anxiety disorder. So, what is anxiety disorder? Anxiety disorder is actually a type of mental health disorder. So, the triggering factors are due to the excessive worriness, fear, and it also tends to affect their daily lives. So there are a total of 6 types of anxiety disorder, which are generalized anxiety disorder, panic disorder, social anxiety disorder, specific phobia, obsessive-compulsive disorder, last but not least, post-traumatic stress disorder. Generalized anxiety disorder. So, generalized anxiety disorder is a mental health condition which is due to constant and excessive worriness in which interrupts their daily activities. The symptoms include irritability, feeling easily tense or fatigued, having difficulties in concentrating, muscle tension, or sleeping difficulties. Basically, they are concerned about their daily tasks, such as job duties, family help, paying bills, and etc. Panic disorder. Panic disorder involves fearful feelings which occur unexpectedly, accompanied by palpitation, which means increase of heart rate, fear of dying, hyperventilation, which also means difficulties in breathing, and etc. The main symptoms include panic attacks, which tend to affect them on a daily basis. Social anxiety disorder. Social anxiety disorder is also known as social phobia. People would tend to have extreme fear in meeting new people, making new friends, presentation, attending social gathering, and etc. They are mainly worried about being judged or being watched by people. Specific phobias. Specific phobia is an intense fear of any specific objects, animals, or even in any situation which could trigger fear, causing anxiety. They'll tend to avoid to think or talk about it. It is scientifically proven that it is more common in female than male and it causes severe distress. Obsessive-compulsive disorder. Obsessive-compulsive disorder, which is also known as OCD. So people with OCD tend to have regular obsessive thoughts and compulsive behavior, such as washing hands repetitively, which are beyond their control. Post-traumatic stress disorder. Post-traumatic stress disorder, which is also known as PTSD. So PTSD is a mental health condition which brought on by traumatic incident. People with PTSD could have experienced or witnessed those traumatic incidents. Some of the symptoms include flashbacks, nightmares, difficulties in sleeping and concentrating, and feeling tense all the time. So here are the anxiety statistics for the year 2020. As we can see, 4th of August to 5th of September holds the highest record of 55.1% and followed by 8th of June to 5th of July, which is 52.7%. 6th of July to 3rd of August holds the record of 48.8%. Last but not least, 12th of May to 7th of June holds the lowest record of 32.3%. question is, how do we help someone who suffers from anxiety? Well, the most effective solution is to help them stay focused, to bring back their thoughts to the present and practice on breathing techniques. So now let us watch a video on how to help someone who suffers from anxiety for better understanding.
Hi, this is Dr. Jenny Byrne. I'm an adult psychiatrist. I have a private practice called Cognitive Psychiatry of Chapel Hill. And today I wanted to share with you some tips. If you know someone, a friend or loved one that's having trouble with anxiety, some things that you might be able to do to help. So the first thing that you can do to help, which I always recommend, is listening to the problem. So anxiety means different things to different people. And many people won't even use the word anxiety. So listen for words like nervousness or worry or feeling tense or unable to relax. These are some other words that people might use to describe how they experience anxiety. So as a listener, you want to ask them questions like, well, what does it feel like? Do you feel it in your body? When is this happening? How long does it last? What's it like for you? What kind of thoughts pop into your mind when this happens to you? And you can sometimes help them really clarify in their own mind what anxiety is like for them. And sometimes that just by itself can be very helpful. The second thing you can do if someone's having acute anxiety, like they're having a big wave of anxiety come over them, and maybe they're complaining about things like feeling dizzy or upset stomach or tingling, this might be a panic attack, and it's important for you to understand what a panic attack is. A panic attack feels like a big wave of anxiety that comes over you, and it affects both your thoughts and your whole body. So different people feel it in a different way, but some people feel it with things like headache, dizziness, feeling like they're going to faint. Some people feel it in their gut, like nausea, vomiting, diarrhea, stomach cramps. Some people feel it in their arms and legs, and they have strange kind of tingly feelings. Really can be different presentations, but this panic attack tends to last about 15 minutes, at least the worst part of it, and then it goes away. So if you think that someone you know is having a panic attack, what you can do is just sit with them and ask them what they're going through, what are they feeling, and ask them, do you think this might be a panic attack? What does this feel like? And sometimes if the person is able to identify that what they're experiencing is a panic attack, and they're able to tell themselves that it's going to go away and that they're going to feel better soon, this will really help the panic attack resolve faster and maybe be less intense. So kind of being aware of panic attacks and asking the person if they think that's what it is could be really helpful. A third thing you could do if someone's having a lot of anxiety is, you may want to get them to see some professional help. If the anxiety seems to be really interfering with their life, like, they're having panic attacks and now they're afraid to drive, or they're getting really anxious and they're starting to be afraid to leave their house, or maybe just they're worrying all day long and they can't think about anything else or anyone else because they're just worry, 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 worry. These are some examples where you might want to get help. Now for anxiety, sometimes it's good to see a primary care doctor. So for example, if your friend or family member has never ever been anxious before, and this is brand new for them and it's really intense, you might want to go to a primary care doctor. The reason for this is there are some medical conditions which look like anxiety. So for example, thyroid, which is a gland here, sometimes if you have too much thyroid hormone, it can look like anxiety. There are other medical conditions that can look like anxiety, so sometimes seeing a primary care doctor is a good first step. So say the person has already gone to primary care and the primary care doctor says, oh, there's nothing to worry about. Then you might want to consider seeing either a psychiatrist or a psychologist to get more of an assessment. A psychiatrist is a medical doctor who does specialty training in psychiatry, so they're able to both prescribe medications and do counseling or therapy. And a psychologist or other kind of counselor is able to do the therapy part but not the medication part. And there are certainly many medications that help with anxiety, but I think what's really important to know is there are many treatments which are not medication, which really help anxiety in the short and in the long term. So you might be able to really help your friend or loved one by getting them assessed and maybe looking at what some of the ways to help them with the problem are. So again, some of the things you can do for someone with anxiety is really listen to them, help them clarify what is actually happening, what are they worrying about, what is the anxiety about. The second thing is to help them, if they're having a panic attack, to identify the panic attack and that they can tell themselves this is a panic attack, it will pass. And the third thing is help them get professional help if they need it, either a primary care doctor to rule out a medical diagnosis or a psychiatrist or a psychologist. So anxiety is extremely common. It's estimated, probably 1 out of 3 people have some kind of anxiety problem in their life. So it's not unusual at all. It's probably someone you know that has a problem like this. So if you can reach out and help them, they'll be very appreciative. Take care and be well. If you have more questions for me, please feel free to contact me, or you could follow us on social media on Facebook and Twitter. Bye-bye.
So this is the citation. All right, that is all from me today. Thank you so much for your time.